Welcome back to the hourinvite podcast. My name is Nima.
My name is Aaron.
And today we're joined by a very special guest, Dr. Richard Harris, board certified internal medicine physician and pharmacist, and also the founder of Great Health and Wellness. Thank you so much for joining us, Dr. Harris.
Thank you for having me, guys. It's a true blessing and an honor to be on your show.
Thank you so much for taking the time out to speak with us. Just for our listeners and viewers, can you just tell us a little bit about yourself?
Yeah, sure. So I am an internal medicine physician, pharmacist, and I just finished my MBA. So yes, I am crazy. There's a pool going on if I'm going to go get my JD or not after this. So that tells you everything you pretty much need to know about me. Right now, I'm focused on two key areas, and that is creating informed health consumers so people can make decisions about their health from a place of knowledge and power. And the second is scalable efficiency in medicine, because medicine is an inefficient beast. And we do a really poor job of leveraging technology and available resources to help people. And so in my consulting business, well, that's what I do. I help companies, innovative companies, navigate the waters of healthcare to try and offer solutions that are beneficial to everybody.
So let me just start, since you brought it up. Are you going to do the JD? Come on, give us the exclusive. Are you going to do it?
Never say never, right?
Okay.
There was a guy in my medical school class who was 45 years old when he started. Oh, wow. And he had been a successful businessman and said, you know what, I always wanted to go to medical school. So he said, screw it, sold his business, went to medical school. And in my pharmacy school class, there was a woman who started when she was 50. She was in the military. She retired from the military, and same thing. She said, you know what, I always wanted to be a pharmacist. And so she went to pharmacy school at 50. So I use those two people as inspirations that never say never, and you're never too old or young or whatever to go and acquire more knowledge.
That's funny, because before you came on, me and Aaron were having a conversation, and I was like, if I was a little younger, I would probably go pursue the JD after school. But the age thing, I don't know. But then you said that, so I don't know. You might change my mind now.
There you go. Join the crazy crew.
Yeah. So after completing your Doctor of Pharmacy degree, what made you want to go get that medical degree?
Yeah, so my journey has been really circuitous. It's literally all over the place. When I was a kid, I wanted to be an MD. My parents found a picture I drew when I was like 3 or 4 years old that said, when I grow up, I want to be a doctor because I want to help people. And then I read Gifted Hands by Dr. Ben Carson, probably, I think I was like 10 or 11 years old. And I said, yes, I want to be a doctor. And then that switched when I took high school physics. And I loved physics, and I thought I wanted to do biomedical physics and make prosthetics. And I realized that I loved physics and I hated math. I got to differential equations and I was like, nope, I'm out. This isn't for me. And so I switched into biochemistry, thought I wanted to do bench research, did bench research for 2 years, hated it. And then at that time, I was like, I don't know what I'm going to do. I'm about to graduate with a biochemistry degree. I don't like research. I don't want to be a teacher. Like, what else can I do? And I worked in the dean of the pharmacy school's lab. And he said, you know what, come to pharmacy school. I think you'll enjoy it. I said, okay. I had no idea what a pharmacist did, no idea what pharmacy school involved. I just applied, got in. And then I realized I love learning about pathophysiology. Like, that is one of my prime areas of interest. And in my first year in pharmacy school, I decided that, yes, I want to go to medical school. I looked ahead in my life and I said, okay, when I'm 65, looking back in my life, will I be mad at myself if I don't go to medical school? And after a couple of weeks of soul searching, I found out the answer was undecidedly yes. And then the next decision point was, okay, well, do I quit pharmacy school to go to medical school? And I said to myself, you've never quit anything in your life. Don't quit this. This will be a stain on your life forever if you quit doing this. And so I said, okay, let me finish out pharmacy school. And then by the end of pharmacy school, it cemented my desire to go to medical school because I felt like pharmacists weren't getting enough respect. This was in 2008. So the collaborative practice agreements and some of the things that pharmacists can do now, the direct prescriptive authority that's coming up in a lot of states, that wasn't available back then. And so I wanted to go to medical school to show people what a pharmacist can do. And it was funny. My medical school classmates hated me because I really didn't have to study. I worked 20 hours a week right across the street at MD Anderson in the pharmacy. I aced all the tests. I didn't have to work that hard on wards because I'd already done that for a year. And then I came out intern year, and like within a couple days of starting intern year, people were like, "Oh, you're the pharmacist? What should we do about this patient, that patient, this patient?" People would say you're functioning like a second or third year and you're an intern. Like my upper levels would just be like, "Oh, Richard's on my team. Okay." They would just take off at like 1:00, be like, "You know what, Richard, you handle the rest of this." And that's what I did. So, that's a long story, but that is what shaped my desire, my craft, and why I decided to go to medical school after pharmacy school.
Yeah, so you mentioned a lot of things just now about how it was a little bit easier in medical school. So how did pharmacy school and being a pharmacist as a whole help your medical career, the whole journey?
It's interesting. So people ask me all the time, what was harder, medical school or pharmacy school? And I say undoubtedly pharmacy school. Pharmacokinetics is the hardest class I've ever taken.
Yes.
Yeah.
We agree.
It doesn't even, I've taken engineering physics, calculus, all those organic chemistry, all those classes that people think are hard. It doesn't even compare to pharmacokinetics, not even close. And so it prepared me because I already knew a lot about physiology. I already knew a lot about pathology. And the only thing I really needed to learn in medical school was diagnostics. And being a diagnostician is an art, and that takes practice. And the other thing I need to learn was anatomy. I had taken some basic anatomy courses in undergrad, but it's nothing like the depth that you go into in medical school. So that was really the only time that I felt kind of like a fish out of water. This is something new. And I'd already knew the rigors of the coursework, because going through pharmacy school had prepared me. I knew what I was stepping in day one. I knew exactly what to expect, how the tests were going to be, how the information was presented, how I needed to study. So I only took a year off in between. So I was already ready. Mm-hmm. And, most of my classmates, they got smacked in the face within the first week with the course load. And I'm like, "Oh, you guys can't handle this?" Suckers.
So you obviously have both the degrees. Do you think you get more recognized from the physicians for having a pharmacy degree, or from the pharmacists of you having a medical degree?
Definitely from the pharmacists. Pharmacists look at me like I'm some type of unicorn, which is kind of interesting. And I always hear things like, "Oh my gosh, I'm so glad you did this. Thank you for being a champion and advocate for pharmacy." Because pharmacy was my first doctorate, that was my first degree. I didn't finish my bachelor's. So another interesting fact, I have 2 doctorates and a master's, no bachelor's. But I'm more proud of my pharmacy degree than my MD, because that was the backbone, that was the foundation that outlined my entire practice and my entire philosophy. I think pharmacy school prepares you to be a better leader. I think pharmacy school prepares you to be a better thought leader as well. So there's multiple aspects of leadership. I think pharmacists are better at that. I think pharmacists are better at the holistic perspective because of the background in pathophysiology. Pharmacists understand the impact of like medications on a head to toe level. You're thinking of everything, from what is that medication doing to the brain, to the heart, all of these different systems, where most MDs are taught to think of everything in isolated systems, and they're not thinking what the left hand is doing is affecting the right hand, where pharmacists are looking at the entire body and saying, "Okay, where can I optimize things here? And are there any deficits? What can I do?" Yeah. So that to me was so beneficial in crafting my career. And I don't think I would be the physician that I am, the thought leader that I am, and the position I'm in today without my pharmacy degree.
So you just mentioned holistic care. So can you speak about your interest in holistic care and why you're so passionate about it?
Yeah, so goes back again. Everything starts with that foundation to pharmacy. Because I'm a pharmacist, I know how the drugs work, and I know that drugs work on the macro level, right? Let's take statins, for instance, billion-dollar blockbuster drug, millions of people on statins. If you look at the absolute risk reduction, it's about 3 to 9%, depending on the study you look at. So that means if there's 100 million people on them, that means that 3 million to 9 million are going to see some benefit. That means that 97 million to 91 million people are going to see absolutely no benefit. So yes, at the macro level, if I can save 3 million people, absolutely I'm going to do that. If I can save 9 million people, absolutely I'm going to do that. But if it's a person right in front of me and I'm telling you that there's a 97 to 91% chance this is not going to help you, then they're going to be like, well, doc, give me something else. I'm not taking that risk. So that's what holistic medicine is about. If you look at the guidelines for everything, the number one thing they recommend first is lifestyle interventions.
Yep.
But as physicians and pharmacists, we're not taught that. And there's a big reason for that. A lot of the curriculum is written by the drug companies. So they don't want us to know about nutrition and exercise and meditation, stuff that there's great data behind. And that's the approach that I take. And that's the approach that we all should take, because these are interventions that can cause very little harm. For most people, there's very little harm associated with meditation. In fact, I don't know any harm associated with meditation, right? There's no adverse side effects. It's only benefit. So we're doing interventions that have high benefit with low risk. And we're looking at how these interventions interact with every system in the body, because they're all connected. And I think a great point about this now is the gut, right? We've got a gut-brain axis, a gut-lung axis, a gut-kidney axis, a gut-skin axis, a gut-mouth axis. And so I think the interesting thing about the microbiome research is it's starting to get people realizing that, all these systems are connected, and we need a top-down approach looking at the entire body. And that's the essence of holistic medicine.
So I have kind of a two-part question. I love the holistic medicine part. I'm with you. I feel like medications are not always the way to go. I feel like you can treat someone without medications. But obviously it comes down to business and money, and it's going to be really hard to try to convince people, since, you got advertisements on TV, drug companies spending millions of dollars. How are you going to convince the average person or the older person to not take the medication to feel better? So what is your end goal with this of preaching that? Are you trying to change the game? What is your end goal with it?
Yeah, my goal is to open people's minds. And that is the whole concept of informed health consumers. Look, at my heart, I'm a libertarian, right? People are going to do what they're going to do. If you're in the privacy of your own home and you're not hurting anybody, I really don't care what you do. But I want to nudge you in the direction of making better choices. And so that's what everything I do with my podcast, my wellness courses. I don't believe in here's a 2-week plan to lose 50 pounds. Right? Because people do that for 2 weeks and they go back to wherever they were before. And that just creates the yo-yo effect. And then people get discouraged and then they don't even want to try again. And I hear that all the time. Oh, doc, I tried everything. And I'm like, what did you really try? They tried someone else's plan. You need to come up with your own plan. Autonomy is so important. And I think that's what a lot of holistic providers miss is what I do is I don't give you a plan. I help you create a plan, but it's your plan. And so it goes as far as you want it to go or as shallow as you want it to go. I'm just here to help guide you. And so that is my overall goal, is to help get the information out there so people realize there's so many things that go into health. A lot of people just don't even realize that soda's bad for them. I mean, it just blows my mind. People are like, what? I shouldn't drink 3 Cokes a day? I'm like, how do you not know this? It's out there. But so many people think that, it doesn't apply to them. It's not going to happen to them, but it's got to happen to somebody. And if you keep doing those behaviors, statistically speaking, it's more likely to happen to you.
Exactly.
And so that's what I want to get the information about. I think that as physicians, we do a really bad job of letting people know what their risks are. to the core and being honest with them, because we're afraid of hurting people's feelings. Press Ganey kind of screwed that all up to where now physicians are afraid to tell people the truth because it's going to hurt their reimbursement. I mean, that just blows my mind. And so that's why I got outside of the system. But my overall goal is to empower people to take control of their health, because a lot of times people put that control in someone else. Exactly. And they may not have your best interest in heart. They may not try to actually help you. They may be lining their pockets. There's a lot of things that could go wrong there. It's the whole agency problem. And so I think that as a country, the true health revolution is going to come from every single person, but we need to arm them with the right tools to do so.
So right there, you just said we need to arm them with the right tools, and you need to get the message out there. And obviously it can't all be done alone, right? You can't do everything by yourself. Are you educating the physicians you meet every day at the hospital or pharmacists? Are you trying to get people on board to understanding your thought process, the way you're looking at it?
Yeah, absolutely. I'm working with a couple groups who are trying to do that right now. A lot of the physicians I come in contact with, I share my podcast with them. I have a clinical study database. I think now it's almost 600 studies that I've read in the last couple of years, all about holistic medicine, supplements, that kind of nutrition, all of that. And any of them that want it, I give them access to it. Because I think another problem is the barrier of entry to do this is so high. There's a time barrier. There's also a monetary barrier. I didn't do IFM or any of those other associations because I was like, I'm not going to pay like $6 or $7 grand to have someone else interpret the studies that I can go read myself. So that's what I did. I just started reading every single study I could possibly find for the period of a year, listening to PhD. So I went back to the basic pathophysiology to start understanding that better. I started reading about psychology to understand behavioral change and mindset better. And that's how I approached it. I went completely self-taught. So I think that in order to make this shift, we have to make the barrier of entry a lot smaller for our healthcare providers.
Yeah, I want to go back to what you mentioned earlier. I'm a personal trainer as well. And one thing I do advocate for is you have to get people to take control of their health. Like you said, diets don't work, but lifestyle changes do. So, it's very important. A lot of people think, you have to do a certain diet and that's going to work for them. Everybody's different. Nobody's body is the same. So I like the fact that you're advocating for that. So you recently received your MBA. Why did you choose to get the MBA, and what are your future plans with adding that extra degree to your belt?
Sure. So the MBA came about as another forward-thinking discussion with myself. And I had the same exact talk I had about the MD. When I'm 65, if I don't do this, will I be mad at myself?
Yeah.
And the answer came back, yes. And then I said, okay, what's my why for getting the MBA? Because a lot of people question, I was like, you don't need an MBA. Why are you doing that? Blah, 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 blah. You can just go learn the stuff on your own. I'm like, yes, I can. But I'm the type of person that I need to structure learn before I unstructure learn. Because if some people are able to do that unstructured learn fantastic, but I like to know what I don't know. And it's a lot easier for me if I go to people who have walked this path and they give me information, and then I can kind of fill in the gaps. Okay. And of course, practical experience, being an entrepreneur for the last 2 years has taught me a lot more about business than my MBA did, but the MBA gave me a solid foundation. And then the other reason is when I was 20, my dad lost his job and he was out of work for 8 months. And he told me at that time, he was like, Richard, there was a certificate that I should have gotten when I was younger and I didn't get it. And the reason I'm not getting these jobs now is because I didn't get it. And he was like, don't ever let something that seems daunting, a 6-month or 2-year task prevent you from doing something that could ultimately help you. And if you look even at the data, no one gets hurt by getting an MBA. And you don't need it, but no one gets hurt because a lot of jobs, if you want to go up into the management levels, require it. And I just wanted to be able to do what I wanted to do without any limitations. And then looking at the grand scheme of things, what's 22 months?
Yeah.
It's nothing. It flew by, and who knows how long people are going to be living, when we're in our 60s or 70s,
Yeah.
right? So I said, okay, I'm just going to go do it. It's going to allow me to help bridge this gap between physicians and business people because I can speak both languages. And that's another huge gap in medicine. And a big problem we're seeing it in the hospitals is that there's a huge disconnect between the business leaders and the physician leaders.
What do you think has sparked your interest of wanting to always keep learning? Was it the way you were growing up? Was there someone around you? Was it something that you just learned as you moved on through life and wanted to and gain interest from it?
Yeah, all of those things, really. I did a presentation to the pharmacy students at Howard, and they wanted me to talk about the growth mindset. And so I was beginning to think about, okay, when and where did I acquire the growth mindset? Because the earliest thing I can remember about it was in 7th grade when I tried out for the basketball team. I didn't make it. And instead of getting upset and feeling like a failure and beating myself up and saying I'm not good enough, I said, okay, I need to make a plan to get there. Well, how do I get there? I said, well, first, let me start playing with people better than me. Because if I play with people better than me, I'm going to get better. And then I made a plan. Okay, I'm going to work on my dribbling for 10 minutes, then my shooting for 10 minutes. Then I'm going to mock play defense for 10 minutes. All right, I need to build up my strength. So I started doing some body work exercises at the house. And the next year, it was funny. I went into tryouts, and the guys were like, middle of the tryouts, they're like, Richard, tone it down. You're making us all look bad. So I went from not even on the radar to other people trying out or in practice telling me, stop, you've already made the team. Like, give the rest of us a chance. And I think that mindset came from my grandfather. He used to always tell me, forge ahead. He always praised effort. It was more of the effort. And if you didn't get the outcome, it was more of, well, why? And let's get a plan to come up with the outcome that you want. And that's the whole essence of the growth mindset. And then I just took that and kept running with it. And I've always done better the more knowledge I acquired. I've never been hurt by acquiring more knowledge, by getting new skills, by trying new things. And that's pretty much how I've set up my career. And it's opened me up to a whole wonder of things that I never thought that I was going to do.
Awesome.
As an African American, I feel we are underrepresented in the healthcare community. So how much, I don't want to say burden, but how much sense of pride do you have knowing that you're representing minorities very well in the healthcare community?
It's sad because, yes, I think we need to celebrate having minorities and being doctors and lawyers and engineers. But at the same time, it's a sad state that we have to celebrate doctors being lawyers and engineers and healthcare workers, because it should be just the norm.
Exactly.
It shouldn't be, let's celebrate Black doctors. It should be, let's celebrate doctors, and there's an equal representation of Black and Hispanic and Asian and Caucasian. So, that should be celebrated. Right. So, I try to give people hope. The kids I come and talk to, I mainly do it because I know psychologically it's powerful to see someone who looks like you in these positions. And kids need to see that, because the mainstream media just shows African Americans as rappers and sports stars. So that's what kids grow up and they want to be. But there's such a small chance of doing that. And I'm not saying don't shoot for the moon, but have a backup plan. Always, always, always have a backup plan, something that's practical, that you can do, that you can provide for yourself and your family. And so I think it's important that kids see that they see doctors and lawyers and engineers and business professionals that look like them, so they aspire to be that. Because I don't know many African-American kids who are running around saying, I want to be a doctor, or I want to be a lawyer, or I want to be an engineer. And so we need to flip that whole paradigm, and the media is major at fault here. They need to show more diversity in the healthcare providers and the other professionals so that kids aspire to be that.
And sorry, another question. So how do you think, people like myself and yourself can go about making that change happen? I know the media, they're going to do what they want to do. That's just how it works. How do you think we can do that? We're, myself and Nima, we're both minorities, and we're really trying to do a lot of webinars, show like, hey, like, you can do it. Like borderline came from nothing. So how do you think, people on the grassroots level can do a better job of advocating for minorities in healthcare to make so that they're not minorities?
Yeah, I think you guys are already doing it. You're doing a great job. I mean, you're further along than when I was your age and in pharmacy school. I was a complete idiot. Just kind of.
I doubt that. You definitely knew more than us.
We are too.
I was just kind of running around, partying all the time, that kind of thing. But we all have a platform and a voice. Yes. And so you can find a way to make your voice impactful. And so whether that be a podcast or a YouTube or a TikTok or an Instagram, there's a way for you to share your message and share your platform. And then there's groups out there who specialize in doing this. I connected with a lot of groups before COVID who were interested in having me come out and just speak to kids just about my life and my journey and about, becoming a professional. And so there's a way now, there's a platform for everybody to get their message out there. It's just be bold, find it, and take full advantage of it. And part of it's also, people think, well, I don't have anything to offer. Yes, you do. Your story has meaning. Your story has power. Your story can help someone else because someone else is going to walk through a situation very similar to what you walked through. And if they have that story in the back of their mind, be like, you know what? I heard this person say they went through something like this, and this is how they got through it. I'm going to try that. So don't undervalue yourself. Your experiences have power. That knowledge has power, and it can help somebody.
So throughout my life, I've always had to work also extra harder to get something maybe that came easier for someone else. Can you speak on, you have 2 degrees, you have three degrees, and the fourth one coming, the JD. But can you speak on the path, on like the obstacles, how you dealt with them? Even as a professional right now, our audience is a mix of students and professionals. Could speak on how you dealing with those, the no's that you get, the blocks that come through. And I mean, you've gone through so much and you've always achieved what you set your mind to. Can you just speak on that on a student level and a professional?
Yeah, as a student, at first, I'm never that person who things come easy to. Whenever I try to pick up a new skill at it, I suck and really bad. I'm terrible. I mean, just like basketball, I used to love drawing and art. I was terrible at that when I started. When I started driving, I was terrible at that. Got into 2 accidents like my first week of driving. I'm not naturally gifted as far as talent goes. But what I am gifted with is being inquisitive and always trying to figure out how stuff works, why it is the way it is, and just asking questions. And then I would always not take what people tell me at face value. Like if someone told me I'm not good enough, I'd be like, well, why do you think that? Why are you qualified to say that? You don't even really know who I am. And the older I got, the more I realized is this person doesn't know me. They're just reflecting their own internal pain outwards on me. And so whatever situation I was asking them or place we were in or environment, it was making them uncomfortable and they were reflecting their uncomfortableness outward. And it had literally nothing to do with me. So I learned that, I applied that. And then, I've heard things all my life. I heard no all the time. When I told the counselor I was thinking about going to pharmacy school, they were like, you'll never get in.
That's me too.
We all heard this. All three of us.
My undergrad counselor told me I need a plan B because I'll never get into pharmacy school.
Mm-hmm. Yeah, I was told let's go get a master's degree. I think we've all been there.
Yeah, it's crazy, right? And then you're like, okay, thanks for the motivation, right? Right. That's all it did is it motivated me. And I went back and I put my letter of acceptance on that counselor's desk and I just walked out. In pharmacy school, I heard from one of the administrators that I needed to be a beacon for my people. And I was like, hold up, wait a minute. you can't tell me that. Like, I
Yeah.
am who I am. I'm going to do what I do. I'm going to try to be the best person I can be. I'm out here volunteering in the community. I'm helping out. Just because you don't like the way I approach certain things doesn't mean that I'm doing it wrong.
Exactly.
And some other things, my first job, your first job, you pretty much don't know what you're doing. You don't know how to interview. You don't know what to look for in a company. And my first job fed me a lot of lies. They were like, okay, we're going to make you into the leadership and things like that. And I was like, okay, what's the plan? And they could never give me a plan. It's like, if you don't even have a plan for how I'm going to get there, then I'm never going to get there. And so I left to do things on my own. And, when I left, they were kind of like, okay, bye. They didn't even give me a counter offer or anything like that. And I used to do all their media, do all their public speaking, all of that stuff. One of the things I did for them was syndicated across 46 different networks across the country.
Wow.
All right. And they still were just like discarded me like nothing. And I was like, you guys fed me a bunch of lies. Why would I stay here?
Yeah.
If you're telling me you have a plan for me to be in leadership, show me the plan, show me the timeline. And it was always like, well, let's wait and see this. Let's wait and see that. I was like, okay. So you're going to have adversity. You're going to have challenges. It's not how many times you fall. It's how many times you get up. And it's what did you learn in the fall? Because each time I had a fall, I learned something and I applied it. And I fully shared my story because I knew that it could help someone else going through the same process.
When you talked about the speaking job and how you did the 46 things and everything, when is the right time? I guess when you're just getting out of school, getting a new job, you're excited, you want the money, you got the loans. How did you approach that? Because, sometimes you're thinking about, oh, I need the job, let me deal with it. When was the time where were you already planning something on the back of your head in case anything happened? How did you approach that as the students that are graduating now, or even maybe professionals right now that are in the first, second year working and dealing with something like that?
Yeah, it was me working on myself. So when I got out of residency, I was in a pretty dark place. I had gotten far from God. I was just lost. Residency is hard. And for me, it just stripped something from myself. I wasn't who I was. And it took me a while to build myself back up. And once I started building myself back up and reading books and about psychology and working on my mindset, I realized that I was undervaluing myself. And I realized that is the cardinal sin, to undervalue your own worth, that there's nothing worse than that. And I said, okay, from going forward, from now on, I will never undervalue myself again. And if a situation happens where I didn't like it, then I wasn't going to be afraid to leave. I wasn't going to be afraid of what else was out there. And I wasn't going to be comfortable being comfortable. And that's what happened. And so I left, and, people always told me, Richard, you can't be a part-time doctor. I'm like, why not? And that's what I do. Right. I'm a part-time doctor right now. I've been doing it successfully for a year now, and it doesn't look like it's going to slow down anytime. And now I truly have a life by design where I can work in the hospital. I can see my own private clients. I can do consulting, podcasting, speaking. And it was because I wasn't afraid to question the status quo. And I wasn't afraid to leave in a situation that I felt like I was being undervalued, to seek out a situation where I felt like I could be valued and I could do the things I wanted to do to help people.
It's funny you bring that up, because as pharmacists, pharmacy students, a lot of when myself and Nemo were starting our platform, we encountered a lot of opposition, like, oh, why are you doing that? Things like that. And, like you said, you can't undervalue yourself. And we had a lot of value in ourselves. So, it's great to hear that, knowing that you just have to put yourself out there. Things may not work out the way you thought, but you just have to put yourself out there and believe in yourself. So I guess I want to ask you, what are the most important things that you live your life by? How important is faith, and how has that guided you into where you are at now?
Yeah, to me now, faith is everything. When I was far from God, I didn't feel like I was accomplishing my purpose. And I remember the day that I was just fighting so hard. I'm like, this isn't supposed to be this hard. I've done well. I'm helping people. Why is this so hard? And I said, okay, God, I'm just going to give it all to you. And then once I said that, there's just a string of things started happening, one thing after the next, building upon itself. And now it's gotten to the point where I'm building this platform of really being able to truly help people in multiple different avenues. And I know that only comes from God and my faith in him. Now, of course, it hasn't been easy. There's been some really rough times, really hard spots. One of my businesses completely went under because of COVID, but that's life. Sometimes there's some ups, sometimes there's some downs, but I trust in God and I trust in what he's doing. And luckily that business can still be revived at a later time. So to me, faith is everything. And it's belief in God, it's belief that I'm carrying out his will, but it's also belief in myself that I can move forward no matter what is around me because I trust that he is with me.
So in the hospital setting, from my experience and from different hospitals, you see pharmacists are either really involved in the roundings and like with the physicians, and there's hospitals that not so much. Having an MD pharmacy degree, you're basically interprofessionalism. You got it in you right there on your resume. How important is interprofessionalism in the current environment of healthcare?
Yeah, that's a really interesting question because it's split.
Mm-hmm.
So the younger doctors love their clinical pharmacists, absolutely love them, rely on them all the time. There's a group of ER doctors at one of the hospitals that I'm really good friends with, and I'm also friends with their clinical pharmacists. And when I'm down there in the ER just chopping up with them, they rely on the pharmacist for everything. They ask him questions all the time, and he's such a wealth of knowledge. I always tell people, you want to find the smartest person in the hospital, find a clinical pharmacist. They're the most well-read. They know how you treat everything. I mean, if a study literally was just printed, they've already read it.
Yep.
So true.
It's crazy. I mean, there's just like a computer database inside their heads, and that's what they do. And so the doctors who are my age and younger utilize the pharmacist and respect the pharmacist a lot. The older docs in general, just pretty prickly from what I've seen, even in my interactions with them. They had a completely different medical paradigm where it was all about authoritarian and the white coat and don't question me. And, I'm supreme. And that's not how us younger docs are, because we know so many people that were our pharmacists and our physical therapists and occupational therapists. So we hang out with them. They're our friends, they're our family, they're our loved ones. And we realize that the collaborative approach is key. And the amount of knowledge that we have has expanded dramatically in the last 30 years. And, me as a physician, I've come to terms with, I don't know everything. I can't help you with, functional mobility. I can help you a little bit, but that's not my expertise. Yeah. And so I'm going to send you to someone who's an expert in that. Same thing with, meditation and breath work. I know a little bit about that, but that's not my primary area of expertise. So if that's something you really want to pursue, I'm going to send you to an expert in that area who does that all day, every day. So being collaborative is completely necessary. The silo model of healthcare that we have now is not helping anybody. If it worked, 60% of adults age 18 or above wouldn't have a chronic disease, 40% wouldn't have two. So if the current system worked, we wouldn't be heading in this direction of complete and total health collapse, which is the path that we're on now. And the only way we can fix it, and what we do in the functional model, is we have a collaborative approach between all the different specialties. I refer people to chiropractors all the time. I refer people to physical therapists. I refer people to acupuncturists. Whatever they want to do or they're willing to try, I try to have someone in my network that does that can help them, who's also preaching the same message that, hey, acupuncture is great, but you really need to make sure that you're eating what you should be eating at home. Hey, massage is great, but are you exercising and stretching at home? That's the type of message that we need. And I think a lot of providers are afraid of that, because they're afraid if they teach people that they're not going to come back.
Yeah.
But if people like you, if you teach them and you help them, they're going to come back to you. And guess what? They're going to refer all of their friends to you. And that is what a lot of people don't understand in healthcare. That's a basic business principle. That if you do a good job and you treat people right, it's going to be a massive benefit for you.
Yeah.
So, we're switching more now in healthcare towards a value-based care model, more preventative medicine, things like that. So how important is it for you to get other physicians, pharmacists on board with that? Because like you said, like how we used to practice this in the past. So how are you, with your background in holistic medicine, how are you forging that on?
Yeah, so I collaborate with a lot of practitioners all the time for webinars and seminars, videos on the podcast. Prevention is key, and people think today that we're just supposed to get diseased as we get older. Right, so people are like, why should I try? Like, I'm just gonna get a disease as I get older, so why should I even bother? Like, that's just supposed to happen. I'm like, says who? And they're like, well, this is just what I see. And I'm like, what you see is not all there is. And then that's when I educate people on blue zones. And I'm like, okay, do you believe people in the US live longer than some sub-Saharan tribe in Africa? They're like, yes, of course. I'm like, no, they don't.
Exactly.
and people are blown away by that. I'm like, listen, if you give a tribe in the Amazon just access to emergency medical care, if they break something, we can fix it. Antibiotics, if they get an infection, they live longer than we do. And they have no chronic disease, no heart disease, no strokes, no dementia. People literally die from old age. Yeah. When was the last time you heard about people dying from old? It doesn't happen. They died with this or with that. These people literally die from old age. There's no comorbidities. They're healthy. You go to other countries like, Colombia or Spain, there's 70 or 80-year-olds dancing in the middle of the street.
Yeah.
You don't see that here. But that's the norm in other places. And that's all about preventative care and wellness. It's a shame because the US does a really poor job at consumer protection. Our food is literally toxic. You look at McDonald's here, McDonald's in Europe. McDonald's in Europe, you look at the ingredients, it's real ingredients. McDonald's here, you look at the ingredients, you need a PhD in biochemistry to understand what the heck you're eating.
High fructose corn syrup, and that's it.
And it's like all these other chemicals. I'm like, this isn't food. This is like literally a list of chemicals. Like I could probably use this to disinfect my tub.
True.
So that's prevention is key. People don't realize that you can do irreversible damage to your body. Yes, your body can compensate. Your body is wonderful at doing that. But over time, some damage can't be repaired. We can try to mitigate as much of that damage as possible, but there still be some irreparable damage. But you can prevent a lot of that damage from occurring. And that's why for me, I focus mainly on people from 20 to 50. Because that's what I say is the most important years for developing your health savings account. I call it your literal health savings account. So you're making deposits every single day into your health savings account when you're 30. Well, guess what? When you're 70, you can make slight withdrawals from that instead of having a health savings account that's literally empty. And now you're fighting off chronic disease. There's a study that came out this past year that showed if you engage in 4 behaviors, if you eat right, exercise, don't drink to excess, and don't smoke, you can on average live to about 70 before you get chronic disease, about 10 years longer than the average in the US. I think that number's falling, but only 6% of Americans actually engage in those 4 behaviors. 6%, that's it. And that's something so simple. Something very, very simple. And that's why we need a focus on prevention to prevent these diseases from coming. It'll drop our healthcare costs. It'll drop all of our insurance costs. People don't realize insurance is so expensive because everybody's withdrawing from the pool now. There's so few healthy people putting money into the pool. Insurance is a risk pool. It's not a right. It's a risk mitigation pool. People fundamentally misunderstand what insurance actually is. And so it's a risk pool that we all band together to share the risk amongst all the participants. But now you have everyone withdrawing from the pool and not enough people making deposits. And so, of course, the price has gone up. How do we prevent that? Prevention. 80% of cardiovascular disease is preventable. 40 to 45% of cancers are preventable. I think it's actually higher than that if you look at all the stuff we teach in holistic medicine. 40% of dementias are preventable. Again, I think it's higher than that. I think cancer and dementia are probably on the line of 80%. I think that's what the number will equate to when we're done. 90% of type 2 diabetes is preventable. 90% of chronic lung disease is preventable. Look at the most common causes of death. I just listed all of them.
Yeah.
Right. And all in a large number of these are preventable. And that's why prevention is the key.
So right now, obviously, we're in the middle of a pandemic. Can you speak on your experience with treating your COVID patients in the hospital with nutritional therapy?
Yeah, absolutely. It's so hard. There was so many times where I walk in the hospital to see a COVID patient. I walk in there and there's 3 bags of chips and 3 sodas. I'm like, what are you doing? I'm on the cancer floor, and right outside of their room is a vending machine with sodas and candy. I'm like, this is insane, like literally insane. And so I'll tell them there, I'm like, listen, to fight this off, you need to eat plenty of fruits and vegetables. Stay away from all the processed stuff on the menus. Just order, like eggs and veggies or eggs and fruit. Order veggies and a side of meat. And that's all you need to be eating while you're in here, if you want your body to heal itself. And then it blows my mind. I still walk in the hospital. I mean, as of last week, I'd walk in treating COVID patients and they're not on vitamin D. Blows my mind. Wow. There is a wealth of research showing low vitamin D with bad outcomes. Mm-hmm. And still providers, I was talking to a couple of them last week. They're like, oh, people are using vitamin D. I'm like, oh my gosh, seriously, people, like lives are at stake here.
Yeah.
Lives are at stake. And so whenever I walk in and see a COVID patient, I immediately put them on zinc, vitamin D, vitamin C, and melatonin. I had to fight with the hospital because I wanted to use nebulized NAC, right? Because there was a small study that showed that people had glutathione deficiencies with severe COVID, and they wouldn't let me do it. And then I said, okay, well, what about oral cysteine capsules? I know we have to have oral cysteine capsules. They wouldn't let me do it. I'm like, this is insane. I'm the physician, and this is what I want to order to help my patient. And you're telling me I can't do it. And that happens all the time.
Why do you think that is? Why do you think that was?
It's all about formularies. It's all about, okay, we want you to make a decision as long as you make a decision that we say is okay to make.
But how can you practice at the top of your license? How can you practice at the top of your license if you're being blocked?
You can't. It happens all the time. I order something. They're like, oh, you can't order that. I'm like, what? All the time that happens. And so it's really frustrating. And the reason I still work in the hospital is to try to introduce the sickest of the population to alternative medicine. I'm not saying, hey, become a client of mine. I just say, hey, here are some resources that I think could help you think about your health in a different perspective.
How hard has it been to be able to, I guess, educate the patients on that? Because going back to what we said earlier, they're so just like, I guess, brainwashed in that, you got a headache or Tylenol, you got something, like you just pop a pill and you'll be good. Mm-hmm. How hard has it been to educate the patients?
It's been very difficult because it takes a lot of time, right? Because there's so many misconceptions and false information that's ingrained in people's head that it takes a lot of time to unwind that. And you have to slowly unwind those misconceptions. You can't do it all at once because you're going to blow people's minds and then they're going to just shut down. And the other thing you have to do is tell people that you can't make drastic changes all at once. You have to start small. Mm-hmm. I do a segment on my YouTube channel called Wellness Journeys, and I talked about that yesterday. Small changes can lead to big results. And I talked about my own story. I switched to a different pre-workout and I didn't check it well enough. And it had like 250 milligrams of sucralose. And after I started taking it for about a week, I started to get migraines again. I started to have intestinal issues. My joints were on fire. And I was like, man, what's happening? And I did what I call a health inventory. I said I was fine, and then something changed. Let me go back through my behavior and see, what did I change in my behavior or my nutrition or something like that. And I started going through it, and I was like, oh, I got a new pre-workout. Let me take a look at it. Looked at it. Oh, it's got sucralose. And I've had problems with sucralose in the past. So I switched the pre-workout. Within 3 days, the migraines are gone. The stomach issues were gone. The joint inflammation was gone.
Yeah. And
that was just a small change. And so that's the thing you have to tell people, is start small, and then don't expect to build Rome in a day.
Exactly.
Because everyone thinks that they just, oh, I'm going to be healthy, so I'm going to wake up tomorrow and I'm going to lose 50 pounds and I'm going to be perfectly fine. I'm like, no.
It doesn't work like that.
It doesn't work like it took your brain 25 years to fully develop. The body works in cycles of months and years, not days and weeks. So that's very difficult for people to understand. And a lot of times people are so used to the heavy marketing engine for these, quick fix programs that work while you do it. And then you yo-yo back and forth over time, and that's what these quick fix programs want. They want you to keep coming back. Oh, I'm the only person that can fix you. Oh, what happened? You didn't listen to me. Oh, okay. Now you listen to me again, and we'll get you right. And they keep you in that cycle. You keep giving them money and not getting results. So there's a lot of misconceptions you have to fix. There's a lot of behavioral work that you have to do. And that's why I have a lot of that in my wellness program, so people can begin to work on themselves from the inside out.
I think it's important to have a lot more physicians like yourself to be able to educate patients, not only on holistic, but just in general. I was working at the pharmacy this weekend, and this lady comes in to get a flu shot. And she's like, my doctor told me that the flu shot only lasts 2 months. And I was like, no, it does not only last 2 months. And then she kept wanting to argue the fact that her doctor told her and that I'm wrong. I don't know what I'm talking about. But it goes back to the whole thing, like, as professionals, healthcare professionals, it'll be awesome if we could all be on the same page and be able to educate our patients the proper way, rather than just giving misinformation to people left and right. One person says this, the other person says that. It's going to be really hard for people like yourself to be able to educate the patients on the right things when they're getting misinformation everywhere else. So I commend you for what you do. You do an awesome job.
Thank you. And what you just talked about is so essential. We know on average it takes 17 years from research to transition to clinical practice. You still have a lot of doctors telling people saturated fats are bad. You still have a lot of doctors telling people that not to fast, that fasting is bad for you. You still have a lot of doctors telling people that meditation doesn't make a difference, that medication is the only way. And I'm like, there's mountains of evidence that just contradict everything that you just said. All right. People telling people not to eat red meat because red meat is bad. Mm-hmm. And people telling people that, oh, just be vegan. You can eat whatever you want just as long as it's not meat. And then people are just going to pound tortillas and bread and chips all day, thinking that they're being healthy. No, it's so, yes, we need a complete system overhaul. And it starts with the education of the physicians. Yeah. But I'm not as optimistic about that. I think it's a lot easier to educate people than it is to educate physicians, because so many physicians have a big fixed mindset that I'm king and I know everything, and what I learned in medical school has to be right and nothing else is right, unless I say so, unless you can show me, randomized clinical trials on this. And I'm like, you can't do randomized clinical trials on a lot of this stuff because they're too expensive. Yeah, and no one's going to do that. So a lot of times you have to go back to the basic pathophysiology and understand what's happening in the body, and then say that there is some evidence here that shows that this does help. It's not going to be an RCT, but there is evidence that this helps. So it's opening up physicians' mindsets. It's opening up people's mindsets.
So when your whole career is done, when it's all said and done, what do you want to be remembered for doing?
Yeah, so this is something I tell people when I speak, especially about career advice. I always say, if I died tomorrow, God forbid, I died tomorrow, I want people to say, you know what, Richard made a difference. And that's it. That's all I try to do. That's all I want to do. I really just want to leave the world a better place. I want to make an impact. I don't really care about making money. I'll make money if I make an impact.
Mm-hmm.
And that's what I focus on. I focus on the impact. I don't focus on the dollars coming in and out. So that's really my life goal, is to try to get people to see health in a different light, and to try to help people with their mindsets and how they approach a problem. Einstein said the most important part about the problem is how you look at the problem. It's not the solution. It's how you approach the problem, the framework that you look at the problem at. And that's so important, and something that a lot of people are missing today.
If you were to go back and do anything different in your life or career, if anything, what would that be?
Invest in Amazon and Tesla.
I feel you.
Now that on a serious note, I would have taken more business classes in undergrad. That's the one thing that I tell, business and psychology, because you'll never go wrong learning about business principles, and you'll never go wrong learning about how the mind works and how interactions with people work. Because yes, I loved what I was learning, chemistry and biology and all of that. But as soon as I got into pharmacy school, all those classes became worthless.
Yeah.
So the pharmacy, it just supersedes it. And I'll never use that type of information. Really, again, I'll use the basics and the understanding of the cell biology, but it's not as valuable to me as if I had gone and gotten the business learned about psychology, sociology, or maybe even Spanish, taken a foreign language, something like that had practical application to the rest of my life. So that's what I tell people. If you're thinking about going to graduate school for something that's going to change your trajectory, do stuff in undergrad that's going to help you when you're 45, 50 years old.
Mm-hmm. So you have a true passion for education, and you have said in the past that you want to be a dean of a pharmacy school. So do you have a school in mind? Do we want to put it out there?
I mean, going back to my alma mater, UT would be a dream. That would be a dream. I really want to teach at a pharmacy school. I think that's my quote unquote retirement plan, because I never plan to retire. The thought of retirement seems horrible to me. Just sitting on the couch watching daytime TV. Dad,
Yeah.
if you're listening. So that's the goal. I want to be able to give back and help and craft the next generation of thought leaders and health leaders.
As a dean in the future, what would you want your long-term goal to be after you leave that position?
Oh yeah, be institute, functional medicine training in every single aspect of school. So people get true nutrition training, true training on all the lifestyle things, meditation, how toxins interact with the body. All the stuff that we should have learned that we didn't learn.
Awesome.
This is going to seem like a very basic question, but I think it's really important. How important is it to have a good relationship and treat everybody kindly with respect and class? How important is that in obviously your career and in life, and how can that take you to different places?
Yeah, because you never know where people are going to end up, and you never know who you're going to depend on, or who's going to end up in a position to either help you or hurt you. I've seen that so many times where people burn bridges and it comes back to haunt them. I've never done that, because number one, I always treat people like I would want to be treated. I always treat people with respect. I don't care if you're the janitor or the CEO, I'm still going to treat you with respect, because your job still matters to the overall importance of that company or whatever. If there was no janitor, that would be horrible work conditions.
Yeah.
Terrible.
Yeah.
Right. You'd probably notice the janitor not being there for a day more than you'd notice the CEO not being there for a day.
It's funny you mentioned that, because we interviewed the CEO of
Mount
Sinai, and he said that exact same thing. So it's interesting.
Yeah. Yeah. Because it's true. So, always be kind to people. You never know what's going to happen to that person. You never know where they're at. You know, a lot of times we have the fundamental attribution error, right? Where we say bad people do bad things. And so if someone cuts me off in traffic, it's because they're a jerk. Well, that person could be cutting you off because they're rushing to the hospital to make it to their wife's delivery, or they had an emergency at home. You never know what someone else's situation is. We just think that someone does something and it's because they're a bad person, and how could they disrespect us like that? When really you have no idea about the context behind why they made their decision. Because we don't make decisions in an isolated vacuum. We make them based upon some type of context or something that's going on in our environment. And so that's why you should always be kind to people. It happens to me all the time where I walk into a patient's room and they just start lighting into me and I don't react. I just, same voice, answer questions, all the stuff I'm supposed to do. And every single time at the end of it, they're like, I'm so sorry I was like that at first. They tell me why. I'm like, you know what? That's okay. I understand. We all have days like that. And that's how I approach it. And I think the world would be a better place if everyone had that same type of mindset. Instead of thinking, oh, this person's a jerk or whatever, I'm thinking, man, this person's probably going through something. And that subtle mindset shift has changed the way I interact with people.
For sure. So on the last question, we always ask this question. It's a fun question. I would love to hear your answer from it. Let's say we go back to undergrad, maybe even high school, and we were to talk to your best buddies or the professor, that was super close to you. We'd be like, hey, who is Dr. Richard Harris? What would they say?
They probably call me a jerk. I was super sarcastic back in high school. So I was the guy who was always making fun of people, right? But interestingly enough, I won most thoughtful in my high school because people always knew that if they needed something, if they called me, I was there. Without any question, without any hesitation, I'd always be there to pick people up. Yes, I'd make fun of you, but if you needed me, I was always there for you, seriously. So that's probably what people would say about me from my high school days.
For sure. Well, I want to first of all thank you so much for taking the time to do this. I know you're super busy. You got a lot on your plate, not only an entrepreneur, but a physician and a pharmacist. And I want to let you know that whoever your patients are, what hospital you're working for, wherever you are, they're blessed to have you, because the knowledge that you have and how you're approaching just healthcare in general, there's not too many of you out there. So we appreciate you and everything that you do and how you are and the way you act, the way you practice everything. So we really appreciate
Thank you so much.
Yeah, thanks for having me. You guys are doing an awesome job. You guys are way ahead of where I was at your age. So I'm proud of you. Keep doing the work that you're doing. You're making a difference.
Thank you so much. And I wish we could talk to you for 2 more hours, but I know you're busy. So I want to thank everyone that tuned in. My name is Nima.
My name is Ann.
And this was the Hourinvite podcast.